So, good morning. The objective of our time together is to understand the most important points in the third part of the cardiovascular system. So, last 2 weeks, we studied the biochemistry of blood, the chemical composition, and then we studied all the different special cells in blood, and then we studied the heart. So the heart was like a double pump. It is going to create enough pressure to push blood to every cell in your body. So the blood is going to deliver all the requirements for survival of the cell. It's going to give it nutrients, glucose for ATP formation. It will provide it with the hormones that we studied in the endocrine system. So everything a cell requires for growth and division and life to be alive, it's the blood that's going to bring it to the cell and the tissues. Blood also is going to remove the byproducts of metabolism, like urea, carbon dioxide from the cells. So it's very important. Blood vessels are very important for life and for maintaining homeostasis. So the third part of the CV system is the blood vessels in circulation, and that's what we'll concentrate on. Here are the learning outcomes. So by the end of this chapter, you should understand the anatomy and physiology of arteries and veins. So we'll talk about the different vessels, which are arteries, arterioles, capillaries, venules, and veins. We'll study the histology of it. What does it look like? And then we'll study all the forces that will account for capillary exchange. So it's, blood vessels are like a capillary tube, right? So we'll study the resistance, the pressure, and then we'll also study some major blood vessels in our body and some major veins. Very interesting. Why is the cardiovascular system so important, especially the arteries and veins? It's because 1 in 3 human beings, 1 in 3 of us will die because of a cardiovascular disease. This is profound. It's very, very important. The scientific study of blood vessels is called angiology. So when you say blood and the circulatory system, it's a closed circuit. So blood doesn't have a beginning and an end. It goes just round and round, round and round. So it's called as a closed circuit. So there are 3 types of vessels in our body. Arteries will carry blood. This is mostly, right? It will carry blood away from the heart. A stands for away from the heart. Veins, arterioles are small arteries. Capillaries is where the magic happens. So this is where the exchange of nutrients happen. Oxygen and nutrients will enter the cell. Carbon dioxide and metabolic waste will exit the cell at the capillary bed. So this is the site of action. So this is the place where exchange happens. Venules will collect the deoxygenated blood from the capillary bed, and then it becomes a vein, which is larger in size, and it returns back to the heart. So you can see our artery is nice and thick. It's carrying blood from the heart. And then it branches and branches so that it can reach all the cells. So a small artery is called arteriole. It's a baby artery. And then that enters the capillary bed. So this is where the tissue is. They're all waiting for food every minute. And the artery is going to bring in all the goodies. And then it exchanges it for the toxins and carbon dioxide. And then it returns as a venule, is a small vein, and then it becomes a large vein, and back to the inferior and superior vena cava that will enter the right atrium of your heart. So I was looking at this animation here. And again, when I was telling you coronary artery disease and how severe it is. So over the years, unhealthy lifestyle that's loaded with trans fats and cholesterol like if you eat French fries and burgers every day, right? And then cream cheese and all the fatty things. And we know that the inside lining of the arteries is a simple squamous epithelium. And the phospholipid bilayer is permeable to cholesterol. So it enters in and then it starts to thicken the walls. So the plaques form over a period of time. So as the plaques form and the arteries stiffen, the blood has a hard time flowing over it. And then there's an obstruction to the blood flow. So this is when they will come in and put stents, bypass surgery, double bypass, triple bypass, and all that. This is very serious. So we see this happening all over the world because of our lifestyle. So here, this picture we saw last week also. So the heart and this cardiovascular system is a closed system. So you can see from the right side of the heart, when the right ventricle contracts, it's going to push the deoxygenated blood that it received from the superior and inferior vena cava into the lungs or the pulmonary circuit. And then when we breathe, it will load up on oxygen, and then we get rid of carbon dioxide, and it's returning to the left atrium. And when the left ventricle contracts, it's going to push the blood. Tremendous force here. Lots of force. That's why, like in forensics, if somebody gets hurt or like gets stabbed in your heart, in the aorta region here, the blood can splatter up to like 30 meters. The pressure is very high. And then I read reports of like how it's like as thick as a garden hose, huge, the biggest vessel in your body. So when it contracts with force, the blood is like pushed in high pressure. So we need that pressure so that it reaches every cell in your body, so that no cell in our body is hungry. And then as it comes back, so it does its job in the capillary bed and it comes back to the heart, where it can go to the lungs, pick up oxygen, and then it comes back to the heart and it's pumped. So this is a closed circuit. It goes round and round. So the pulmonary trunk is going to carry blood from the right ventricle to the pulmonary circulation. Pulmonary, pleura, they all refer to your respiratory system. Aorta carries blood from the left ventricle to the systemic circuit. When you say system means body. Systemic circuit, taking to the body. Capillaries. This is the site of magic. So here, the blood vessels are going to become smaller and smaller and smaller because they have to be fine, very fine, so that it can wrap itself around the tissues to give in nutrients and for gas exchange. So you can see at the tissue level, oxygen is entering the tissues and carbon dioxide will enter. So that the exchange happens at the capillary bed. So what are the three tunics? Tunic means coats. There are three main layers in the artery and vein. Both of them have the three layers. So if you were in the lab, you would have seen a histology. That means a slide of artery and vein. And you can see this is the artery. It is very thick walled. And you can see all the different layers. And then this is the vein, which is very thin walled. It's very thin walled. So arteries and veins are nothing but tubes, right? So the circular empty space inside the tube is called as the lumen of the vein and lumen of the artery. And here you can see all the different layers. The inside layer, tunica means layer or coat. So tunica intima, intimate, like they call your underwear as intimates. So this is smooth. It's a layer of endothelial tissue sitting on a layer of connective tissue that has elasticity in it, elastic fibers in it. So it's called internal elastic membrane. So this is the lining of the artery, inside lining. It's so smooth so that blood can glide inside it. It reduces the friction by being smooth. The next layer in an artery is very thick. So this is where smooth muscle is. Again, you find elastic arteries here. That's called tunica media. Media means middle. The outside layer is called tunica externa. It's also called adventitia. Here, you see a lot of elastic connective tissue and collagen here, so giving it support and strength for the artery. So the artery is very thick walled because the pressure in the artery is very high. Remember, I just told you aorta is going to pump out. So the artery must be strong enough to hold that pressure. Whereas everything is laid back in the vein. Pressure is very, very low in the vein when it returns the blood back to the heart. So that's why you see like a collapsed structure here. Even though it has the three layers, intima, media, and tunica, the proportion is very different. See, the muscle layer is very thin here. So you have to know this picture, and then you can see how the arteriole is becoming the capillary bed, and then it is going back as a vein. So know the three coats of the arteries and veins. It's very interesting. See, there's muscle layer here, and these are living tissue. So they also need blood supply. Even though they are conducting blood, they require blood supply too. So the arteries that supply the blood of your arteries and veins is called vasa vasorum, or vessel of vessels. Isn't it interesting? So like your arteries and veins, they themselves have blood supply to nourish itself. So that name is vasa vasorum. All right, let's follow the journey of blood here. So you can see now we are very familiar with this hook-like aorta. So we have the ascending aorta and the descending aorta, and you can see how it's branching off. So the first segment of artery has to withstand a lot of pressure. So what happens is the artery has a lot of elastic connective tissue in it. So that's why it's called elastic artery. So it's a high, it is built for withstanding pressure fluctuations. The next layer is called muscular artery or distribution artery. So this layer here, this segment here is what is going to go to your different organs. You know, it might go to your liver or your spleen, your kidneys, and so forth. It is called muscular arteries because it has a very thick layer of muscle, the smooth muscle here. So it's called muscular artery. Then it transitions into the arteriole, which is the small artery. You can imagine this. See, when you look at a tree, you see the trunk of the tree, and then it becomes the branches. And the branches will have like tiny branches, all because, so it's like highly branched, right? A tree, so that it can do a lot of photosynthesis. Very similarly, the arteries are highly branched, so that when it becomes the capillary, it is only like one cell layer thick. It's like a tube in a tube in a tube in a tube. So like only the endothelial layer with the basement layer becomes a capillary, so that diffusion can happen quickly. So this is the story with how the artery becomes small. Elastic arteries are also called conducting arteries. They are closer to the heart. It's going to withstand high blood pressure because of the elastic connective tissue fibers that are found in the different layers. Muscular artery is also called distribution arteries. It's going to distribute blood to all the organs in your body. Arteriole is a small artery that will lead to the capillary bed. So when it comes to the capillary bed, it's only one layer of simple squamous endothelial cells, so that diffusion can happen faster. When you heard the word aneurysm, they're talking about weakening of the arteries here, because pressure is high and the blood vessels can weaken and it can burst and cause a hemorrhage, which is very serious. This is a very serious pathology of your vessels. and it can rupture and it can cause all kinds of troubles. So here is a nice close-up of an capillary, and you can see the simple squamous epithelium with a bulging nucleus. And you know epithelium will always sit on a basal lamina, right? Basal lamina. And then in this electron micrograph picture, you can see it's so small that like hardly one RBC is able to squeeze up. So this is when we studied the rule A, how the RBCs can stack upon each other and they can maneuver through these little capillaries that surround the tissues. It's very smooth so that there's no friction to blood flow. So you can see it has lost the tunica media and tunica externa when it came to the capillary here. There are three types of capillary depending on the function of the capillary. Sometimes large molecules have to leave the capillary. Sometimes it's small molecules. There are three types. So this, where the simple squamous epithelium is tightly packed, it's called continuous capillary. So here diffusion is only diffusion of only small molecules and lipids will happen here. Continuous capillary. Fenestrated means they will have gaps between the cells so that larger proteins can wiggle out of the capillary. Sinusoidal means huge holes, large, huge holes like this. So there are three types of capillaries depending on how tight the cells are packed together by desmosomes. Continuous are less permeable. So anytime our body wants to have a blood-brain barrier, this is the best choice, like in the brain. Fenestrated capillaries will have pores in the endothelium. So here there is a rapid exchange of solutes between the blood and the tissue. So you can see this in endocrine organs, chloride plexus of the brain that makes the cerebrospinal fluid, kidneys and intestinal tracts. Sinusoids are sinusoidal. This is fenestrated capillaries. These are the ones which has large gaps between the cells. And this happens wherever filtration needs to happen, like in the bone marrow, spleen, liver. So this can permit rapid exchange of molecules. So three types of capillaries. So this is an animation of how active the capillary bed is. So you can see when more than one artery become one arteriole, it is called collateral arteries. So this, I'm talking about all the terminology that you can see in a capillary bed. If the artery, see here's the capillary bed, it directly becomes a venule. It is called as a thoroughfare. So this is a thoroughfare. Just like driving, sometimes there's a straight street. It's called as a thoroughfare. Here in the junction, in the beginning, you can have sphincters. Sphincters are circular muscles, right? So what happens is our body can control the blood flow in the capillary bed through these sphincters. Very important. So what it can do is it can redirect the blood flow. Let's say there's an injury here. So immediately that sphincter will close and it will redirect the blood so that we don't lose blood. If the artery and venule is connected without the capillary bed, it's called arteriovenous anastomosis. So there is a few terms that you have to study here in the capillary bed. So take a look at it later. So the contraction and relaxation of the capillary bed. So blood is not flowing at a smooth, it's not flowing very smoothly in the arteries and veins. It's pulsating. With every heartbeat, the blood is pulsating in the arteries and veins. So that is called vasomotion. There's like a continuous contraction and relaxation of the arteries happening. All right, this picture is a very important picture. So this picture is depicting how the nutrients, see everything you learned in biology, diffusion, osmosis, facilitated diffusion, exocytosis, endocytosis, all those things are happening here. How does nutrients leave the capillary bed and how does it absorb the waste? So all this is happening because of pressure difference. So inside the blood in the arterial end, blood has lots of colloids in it, right? So it's called blood colloid osmotic pressure, colloidal blood osmotic pressure. So in the arterial end, the blood pressure is very high and the blood is like loaded with oxygen and glucose and all the nutrients, hormones, all the goodies that your cells need are loaded here. And interstitial blood pressure or the pressure or the hydrostatic pressure in the tissue is low. So pressure is high, pressure is low. There is a gradient of nutrients here. So what happens is because of diffusion and other forces, the water, oxygen, amino acids, electrolytes, glucose will leave the blood and it will enter the interstitial tissues. Whereas when you come to the venous end, you can see how the blood pressure now has fallen from 30 mm of mercury to 21 mm of mercury here. So the pressure has dropped in the venous end. But the pressure in the hydrostatic pressure in the tissue is high now. So what happens is because of pressure difference again, all the waste, metabolic waste and carbon dioxide will be pushed into the venal end. So the blood coming in the artery is oxygen rich, nutrient rich blood, and the blood that is leaving in the vein is poor oxygenated toxic blood that is going to, shouldn't say toxic, it's the blood that has urea and metabolic waste in it. This is rich red in color. The blood that is surging through the arteries is bright red in color now, and then it becomes like a pale red when it becomes a vein. So now we are on the other side, on the right side of the picture here, left side of the picture. So here, after the capillary exchange has happened, the small vein that leaves is called as a venule. So you can see the thickness is very, so now this is all high pressure. So like you might wonder, there is no pump here. How does the deoxygenated blood make its way anti-gravity, let's say from the tip of your toes, how does it make its way up to the heart? It's fascinating. It does. So here's a small vein, is called as a venule. So it just has the endothelium and tunica externa with elastic and collagen fibers. Then it comes to a medium-sized vein. So it becomes a little thicker because many venules would have come together to form a medium-sized vein. So here you can see all the three layers. And the largest vein would be having a very well-developed externa media. And then, this is the inferior vena cava and the superior vena cava. It becomes thicker and thicker here. So the veins are larger in diameter. The lumen is much larger. They are very thin walled compared to the arteries. The pressure is very low. The venules are small veins. They are about 2 millimeters to 9 millimeters in diameter. So this is explaining how the vein changes, the anatomy of the vein changes. So the large vein is having all the three layers. So now, how does the vein accomplish this? How does the blood from the tip of your toes go up anti-gravity to your heart again when there's nobody to pump the blood? So One special feature that I didn't mention before is that veins have valves that prevent backflow. So what happens is the valves will make sure there is no backflow of blood in the veins. So these valves are actually tunica intima, the innermost layer that will form these valves. There are two reasons as to why blood can flow back to the heart. It's because of muscle action. It's called milking action of the muscles. So when you move your leg, it will squeeze the blood up the vein. When the valve is closed, or when the muscle is contracted, the valve will be closed. And when the muscle is relaxed, the valves will open. So here, the resistance to blood flow is also very low in the veins. So one reason how blood can flow back to the heart would be the milking action of the muscles or muscle contraction. The second reason is just breathing or respiratory action. So when we breathe, inhale and exhale, and when the diaphragm pushes up, it causes a kind of like a suction that will pull up the blood up your legs. When the valves don't work well, something goes wrong with the valves, blood can pool. There can be a stagnation of blood, and that's what we see, it's common in obese people. So it, and also like some regular people have it too. So this is a valve malfunction. So you've seen, it's called varicose veins. So two ways that blood can move up the veins. There is low resistance, low pressure. It's because of the milking action of the muscles and respiratory action. This picture is very interesting. We might think, okay, we have 5 liters of blood. So now who is holding all the blood in the body? Most of the blood is in our veins. So you can see approximately 60% of the blood is held in the venous system. That's why it's called as a reservoir of blood. And only 7% is in the heart at a time, 7% in the systemic capillaries, 9% in your lungs, in the pulmonary circuit. So this is talking about the distribution of blood, the general distribution of blood in your body. All right, this picture is a very interesting picture. I told you the pressure in the aorta when the blood is pumped, like when the left ventricle contracts with a lot of, force, the pressure is high. So systolic pressure is during systole or contraction. And diastolic pressure is when it's relaxed. So you can see in the aorta, it's about 120 over 100, that region, 120 over 80. So there's a upper number is systolic, lower number is diastolic. Elastic arteries, again, pressure is very high. Muscular arteries, very high. And then as it becomes an arteriole, and then it becomes a capillary bed, venules, medium vein, large vein, and vena cava, you can see how the pressure, so the further away from the heart you go, the blood pressure is dropping. The difference between the systolic and the diastolic pressure is called as the mean arterial pressure. So if you are a cardiologist, these are the numbers that you're looking for. So that's why when you go to a doctor's office, one of the biggest diagnostic tools for disease is taking blood pressure. So here's some terminology. The heart is going to generate pressure P to overcome resistance R in the vessel. Resistance means the pushback to the flow of blood in the vessels. The pressure, this is the pressure gradient. Pressure is very high near the heart, and further away from the heart, the pressure drops. So that is called pressure gradient. So now the arteries the vessels are under it can either vasodilate. So here you can see how the lumen has become large, thereby allowing more blood to flow through, or it can vasoconstrict. So this is the contractibility of the vessels. So for example, this animation here is showing, let's say there was you hurt your skin, and then there was a nick in the artery. So what happens is, this is vasoconstriction. It constricts, making sure we don't lose too much blood. So contractility refers to the change in the diameter of the lumen. So this is under the control of the autonomic nervous system. We studied this, vasoconstriction. So the smooth muscles will contract, thereby reducing the size of the lumen. Vasodilation is the relaxation, enlarging the lumen. I want you to go through these different terminology and definitions that is essential to know if you want to understand blood pressure. So there are certain points in our body, they are called pulsation points. You can palpate, you can feel, and then take the blood pressure from these points. So here, uh, uh, in your temporal region is the temporal artery. You can feel all this, facial artery, the carotid artery. So these are pulsation points. You can take blood pressure from all these points, you can say it. And this brachial artery is the most common. You can use a sphygmomanometer here, the blood pressure cuff, and you can measure. Because blood pressure is a huge diagnostic tool. It is a reflection of what's happening in the capillary beds and in your cardiovascular system. There's also a radial artery, femoral artery, pulsation point, popliteal, tibial, and there's another one, dorsalis pedis artery, pulsation points. So these are all pressure points in our body. These are pulsating, so you can feel the pulse. And I was thinking when I was looking at this, like when people put perfume, they would put some behind their ears. I was wondering, maybe they are putting it on the pulsating points. All right, systolic pressure, as I showed you in the earlier picture here, systolic pressure refers to the pressure when your heart is contracting. Diastolic is when it's relaxed. The difference is the mean artery. Difference is the pulse pressure, sorry. Mean arterial pressure is the diastolic and a third of the pulse pressure. Correction here. A pulse pressure is the difference. I said it different earlier. So the normal blood pressure is 120 by 80. If it is more than this, it's called hypertension. See, this is not good. If the pressure is very high, right? And we just studied that the capillaries are very thin walled. Because if the pressure is so high, it can break, and that's not good. So hypertension. So if it's very low, again, that's a bad scenario too. There is not enough pressure difference to push out the oxygen and nutrients in the capillary bed. The pressure wave in the blood is called as the pulse, and a sphygmomanometer is the instrument that we use to measure blood pressure. I want you to watch this video here, listed here. It's a 3-minute video, and it will talk about how to take blood pressure using the blood pressure cuff. So these are the major arteries here, overview of all the arteries. So you can see here is the ascending aorta. So it's leaving the left ventricle, right? And the right and the left coronary arteries are going to feed the heart. The heart is saying, let me feed myself first before I feed the rest of the body. So you can see the right and the left coronary artery. The part that is going up, so this is the part I told you looks like a garden hose. It's ascending up, right? It's going to take blood up to the head and neck. So it's called ascending aorta. Where it curves is called as the aortic arch. Where it dips down to serve your thoracic region, your abdominal region, and your legs, it's called descending aorta. So from the ascending aorta, the branch that goes to your head is the carotid artery. The first branch is called brachiocephalic artery. That branches into the common carotid artery, and the artery that goes clavicle, under the clavicle, feeding the right arm, is called subclavian artery. Then we have the left common carotid artery, left subclavian artery. Again, it's going under your left collarbone, clavicle, and then it feeds your left arm. And then in the descending aorta, the region where it travels through the thoracic region is called thoracic aorta. When it reaches the abdomen, it's called abdominal aorta. So in this picture, you can see the same, all the arteries. So our brain requires a very rich supply of oxygen. So we have this carotid artery that goes up. And then you can see how it forks out into the internal and external carotid arteries. Renal artery is going to go to your, renal means kidneys, renal artery. Gonadal arteries will go to the gonads. Mesenteries will go to your intestine. So here we see the right coronary artery, and there'll be a left coronary artery. The right coronary artery, we saw this picture earlier last week also, is going to like branch out into hundreds of atrial arteries and ventricular arteries. The one that runs down to the apex of the heart is the marginal artery. And then in the septum, we have the anterior and posterior interventricular arteries. The artery that goes round like a crown is called as the circumflex artery. So the heart is very richly supplied with arteries. Anytime you see an artery, it has to return as a vein. So you're seeing the great cardiac veins also here. The left coronary artery is supplying blood to the left ventricle and the left atrium. The right coronary artery is going to supply blood to the right ventricle and the right atrium, the nodes, and the septum here. So this is the coronary circulation. And this is when this gets a block is when we get heart attacks. Arteries of the brain. So I told you the aorta, and then it divides into the brachiocephalic artery. So here you can see the common carotid artery that is going to divide to form the vertebral arteries. Here's the vertebral artery, internal and external carotid artery. The external carotid artery will go feed all your face, your eyes, your nose, your tongue, and so forth. But here there's an very interesting thing happening here in the base of the brain. So there is like a roundabout, like a junction in the base of the brain, because the brain requires so much oxygen. This it was first described by a scientist called Thomas Willis. So this is called circle of Willis. So the brain is going to receive blood from the internal carotid arteries and the vertebral arteries. At the base of the brain, we have the circle of Willis. And from here, it is going to branch off to feed the different lobes of the brain. So we have the anterior, middle, and posterior cerebral arteries. So the blood is nourishing the brain, because our brain requires a lot of ATP and oxygen for survival. So these pictures are there in your textbook. I want you to go over it. You have to know the large arteries in your body. So the study guide also has a list of arteries here. So here, the artery that goes to your renal, to your kidneys, is the renal artery. When you say mesenteries, they are structures in your digestive system. So we have superior and inferior mesenteric arteries. There's gonadal arteries, hepatic artery going to your liver here. So for example, so this is the thoracic aorta and the abdominal aorta. So in the thoracic aorta, we have the intercostal arteries, and as the word says, it's going to feed your the muscles and tissues between the vertebrae. Superior phrenic artery is going to feed your diaphragm. Adrenal arteries in the abdominal region will feed the adrenal glands. Renal arteries for kidneys. So they're named after the organ that they are going to nourish. So, and so forth. So here we have the axillary arteries that's going to feed the axillary part of your arms, your armpits and so forth. And here's the brachial artery. It's going to divide into the radial artery, right where the radius is, and the ulnar artery, named after the bone it's traveling over. And in your feet, we have the left and right iliac arteries that will become the femoral artery, and then it will branch several times. It becomes the popliteal artery behind your knee. Then we have the tibial artery, thereby feeding the entire feet. And here's the cartoon of all the major arteries that will leave your limbs, hands and feet. So every artery side by side will have a vein also. So in this picture here of the heart, you can see the superior vena cava is bringing deoxygenated blood. So the one that goes parallel to the carotid is called jugular. So we have the right and the left jugular vein, right and left subclavian vein, and we have the right brachiocephalic vein. So you can see the external and internal jugular veins, subclavian veins, brachiocephalic vein. And from the inferior vena cava, we have again, the thoracic region and the abdominal regions. So the vein that goes down your thighs, it's a huge vein. It's called great saphenous vein. Look at that, how long it is. And then we have a smaller saphenous vein, fibular vein. This is very interesting. See here, this picture is depicting the hepatic portal system. Hepatic means something to do with the liver. So what happens is, you can see products of digestion are absorbed in the capillaries from the small intestine here. So that's step one. And then you can see how it is going to go to the liver through the liver here. So the digested, this is called hepatic portal vein. So it's entering the liver through the hepatic portal vein. There's also another point of entry here. These are the hepatic veins. So what happens is, because blood chemistry is controlled by the liver is constantly monitoring. So that's why blood has to visit the liver through these two veins here. So that is called the hepatic portal system. It consists of the hepatic portal vein and all the tributaries. It directs blood from the region of your digestive system, esophagus and rectum, and also pancreas and spleen, and it will bring it to the lungs. Not lungs, liver. So that is the hepatic portal system. So that's the last slide. We can discuss some questions now.